Some of the key factors that we take into consideration to determine if a patient needs surgery or non-surgical intervention. One of them being the extent of the injury, how complicated it is, and one thing we like to address too is what are the patient's goals? Are they even interested in surgery? It is up to us, to make that decision, but it's also up to us to allow the patient to make the decision for themselves. And it's a patient-provider relationship that we can come to an agreement in that process. An example of this would be, say, you had a spinal fracture. How stable is that spine fracture? Is it a very big gap? Is it a very small gap? Can we operate? Do we even need to operate? Does the patient want the operation? Is this fracture going to get worse? Is it going to stay the same? How much distress is this causing the patient? Whether it's surgical or non-surgical, a lot of this has to do with what is your level of pain? What is your level of functioning with your current injuries at the moment? And if you're doing great, if you're having a totally satisfactory life, if your pain is under control, do you really even need a procedure? That is a question that we always have to address when we see each other. Oftentimes not, but in a very small percentage of folks, their quality of life is poor, their pain control is poor, and they've done everything else that to treat their pain with a non-surgical approach. Next step is likely surgery.